Hello, friends. I'm Dr. Thameem, medicine faculty in DBMCI. I'm here to discuss a few tips about how to approach for the new pattern that AIIMS has come out now. So, as you might all be aware already, that AIIMS has changed the pattern of questions in the upcoming exams, and one should be aware of what the new changes are. So, before I start discussing about the changes, although this is not something new, but I want to stress one point over here that as given in the prospectus, questions marked for review shall be considered as unanswered. So as you can see here, that whatever questions that they are giving, these questions that are marked as unanswered, they will be considered as, any question that is marked for review shall be considered as unanswered. So I have seen one student who went on to get first rank in PGI, and that student, we expected him to do very well in the AIIMS exam as well. But he had marked many questions for review, and unfortunately, in the end, he was not able to remove those questions as marked as review, and that's the reason why they were considered unanswered, and he didn't do well. Eventually, he got first rank in PGI, and then after that, in the next exam, that is May AIIMS, he got fifth rank in AIIMS. So, but the thing is, I think it got delayed for him. 6 months delay was simply because I think he was not careful about what questions to mark for review. So I hope you understand that any question that you mark for review, last 20 minutes, make it a point that you're going to remove it out of the review zone. Otherwise, that question will be considered as unanswered. Now, the 7 patterns of questions that are there. One was the routine one, and this is from the AIIMS prospectus, as you can see. The traditional one is still here, that is the single best response, and I think we have all become now pretty good at understanding the tips and tricks and how to go about a single best response question. But the other patterns that are there, new patterns that are there, some of those points we'll discuss as we go along. So now we have multiple true false questions, match the following questions, sequential arrangement, multiple completion. Then we have reason assertion questions and extended matching. And I'll just explain to you briefly about some of these patterns that are there and what you should be cautious about. One big problem that is there now is most of these questions that they're giving, you can make out that the negative marking that is there is almost the same as the positive marking. So in all these additional pattern of questions, the thing is, whatever positive marking they're giving, almost the same amount they've kept for negative also, except for the traditional question that is single best response we've been seeing all these years, which is a negative marking of 1/3. That has been there from ages, that has been continued, but you can make out now more and more questions have been added. Now, before you start worrying, let me just show this very important point at the base. You can see what is mentioned here, that majority of questions for the July 2019 MDMS examinations shall be of the single best response type. So you can understand that these things are going to be an issue for the November AIIMS and subsequent exams, but I don't think it will be much of a problem for the upcoming July exams. Now, at this point, I think one good news also is there, and that is that the image-based questions might come down significantly, and we used to see that AIIMS used to go into a lot of image-based questions. Many of them used to be quite difficult. Although in NEET exam, the number of images that are there are generally easy. Even though images might come, most of them are very easy. AIIMS images used to be a problem, but I think with all these other questions patterns coming up, the number of images might overall come down in the coming exams. So single best response, I think we have all become, having lived a significant part of our life dealing with multiple choice questions, figured out every kind of trick that is there to answer these kind of questions, and this is many of these things we discuss in the classes. And I'm sure many of you might be familiar with the way how to approach a single best response. A very basic approach that I would like to recommend to you is that if you think it's a memory based or a factual question, then generally those kind of questions, you just need to use your memory and select out the best answer you can make out. But if it's a conceptual question, and at this point I can tell you, okay, every question in medicine, there's a logic behind it. So the significant chunk of questions that you see in our exams, especially in AIIMS, are going to be conceptual. So if it's a concept-based question, then do not try to choose what the correct answer is. Rather, try to eliminate the remaining 3 options. So in this question, you can see this is a 12-year-old coming with some nephropathy, and at the outset itself you can tell that this is a nephro question. It is a patient having generalized edema, the serum albumin level is low. So basically they are trying to suggest that this might be going towards a nephrotic presentation. You can make out that this is a 3+ proteinuria and a lipiduria, further telling you that this is clearly a nephrotic presentation. In fact, they are going one extra step and saying that the patient does not have any hematuria, making sure that you can safely eliminate nephritic syndrome from the answer list. So I'm sure you are aware that in all conceptual questions, and in fact every question that is coming in medicine, what you need to do is eliminate incorrect options and narrow down your base into towards the correct answer. So obviously here nephritic syndrome is not the correct answer. IgA nephropathy is a very common type of nephritic syndrome in adults, and it comes with hematuria. So this is also out because this is nephritic. Both these are nephritic. And obviously here this question in a 12-year-old coming with nephrotic syndrome, the first thing that should come to your mind in a child less than 15 years coming with nephrotic syndrome should be minimal change disease. So in a minimal change disease, you all know that light microscopy is normal, immunofluorescence is going to be normal, and there are no immune deposits. So that's the best answer, no immune deposits in the basement membrane. I'm just giving you a sample, but the thing is, I'm sure single response is nothing new that is there over here. But just to give you a very quick tip, and that's what I was trying to tell you here, that all conceptual questions basically focus on eliminating options, and all factual questions which are just asking a single point, then try to just choose the best answer that you can think of. It's very important that you decide whether a question is conceptual or factual, because if it's a factual question, better not to mark it for review, straight answer it and leave it. If you mark it for review, there's a chance that in the end you might, in the confusion, forget to remove it out of review and that question will go. Secondly, all factual questions in the end, last 20 minutes, 30 minutes, I've seen some people try to fiddle with those choices. And any factual question, any memory-based question, if you try to look at it a long time, whatever you marked, the other choices look better. So trying to change the choice in the later part of the exam actually is counterproductive, and that should not be done. Whereas in a conceptual question, any logical approach that you find, if you marked it for review, let's say you come back at the end of the exam and you had some time left and you come back, then in a conceptual question, if you find a logically better answer, you can change it. So what questions you can change the answer and what questions you should not change the answer is something that you should be aware of. So let me just put it forward once again. If it's a factual question, a memory based question, then don't try to change the answer. Like if they're asking you what proteinuria, what cutoff level proteinuria suggests it is nephrotic syndrome. Now you all know it is 3.5 grams. More than 3.5 gram proteinuria is nephrotic syndrome. Like they might ask you a factual question, from where to where is it microalbuminuria? So if the urine albumin is between 30 to 300, that is 30 to 300 milligram, and then in 24-hour urine, or milligram of albumin per gram of creat, that is known as microalbuminuria. Now those are factual questions. Now fact is something that you might be either aware or you may not be aware. If you mark it for review, you are not going to have a better answer at the end of the exam. Whatever you remembered, you answered it. And if you answered it, either you answer it or you leave it, but don't mark it for review. That's one advice. Secondly, if you marked it, and if you come back at the end, if you keep looking at a factual question, then other choices might look better, and that is human nature. Whatever you marked, something else looks better if you keep staring at it for some time. So I hope you understood this idea that if it's a factual question, please don't touch it, don't review it, don't come back and change it at the end of the exam. If it's a concept-based question, then there is good chance that by the time you do, problem is you keep jumping from topic to topic. You're doing anesthesia, next you do medicine question, then you do ortho question. Sometimes you have lack of clarity. When you come back and see the conceptual question again, logically you try to figure out, okay, this now looks logical. That is a better answer. And yes, you can change the answer, and you can get improvement in your ranking if you do that. So this is one advice. So there are many things that I can tell you about single best response, but this is not the time to discuss about a single best response. You all are aware of it, and you all know how to do the answering in single best response question. Now correct answer is +1, and incorrect and negative marking is -1/3. AIIMS has been maintaining that from such a long time, so that continues. But in the new pattern, now they have added true and false questions, and they have made it 5 choices. And one mark now is split into 5. That means you got 1/5 for every choice that you mark correct. You're going to get 1/5. What blows my mind is AIIMS had to use these kind of examples, and some of these are tricky. Some of the sample questions they've given itself are not that straightforward and easy. Like for example, look at the sample question they have given in their booklet, in their PDF about rheumatic heart disease. So these each choice here you need to answer as true and false, just like PGI pattern. So those of you given PGI in the past, you will be aware of how the approach is. Now, how to go about it is just if we solve this question, major criteria are similar for both low risk and high risk. You all know rheumatic heart disease criteria got modified in 2015. So 2015 Jones criteria, some changes happened. And one thing that you'll always be aware when you're preparing for entrance exam is anything that is changed in the recent past is going to be something very important, and they'll expect you to know about it, and that's the reason why they ask a lot of questions in that zone. So rheumatic heart disease criteria changed, and subsequently in 16, 17, and 18, last 2-3 years, a lot of questions came in the AIIMS exam as well as the All India exams as well. So you should know that major criteria are now different for low risk and different for high risk populations. Echo is definitely recommended, and earlier in the old criteria that we used to follow for rheumatic heart disease, we just used to look at clinical criteria as the only allowed one. But now they are saying ki subclinical carditis, which is picked up by echo, and even though they mentioned Doppler echo here, but you know that one of the markers of subclinical carditis is regurgitant lesions, and Doppler can pick that up. So yes, it is a true statement. So the first statement obviously is false. The second statement that they given is true. Monoarthritis included as one of the major criteria. Now you all know ki in the changes in the criteria in 2015 Jones criteria, what they have done, they have separated low risk and high risk, and what India should follow is high risk. So this is what they've given. They've given it as low risk. So you should be careful when you read the statements. Monoarthritis is a major criteria for high risk population, not for low risk population. That means this is false. Now why you need to be worried about these true and false questions? First of all, every statement is 1/5 mark. Many of them might be tricky choices, so you got to be careful when you read. You can't go for the coming AIIMS exam reading the whole night and in a confused state in the exam, because one of the main things that will be tested in this exam is how well your concepts are, how awake you are on the day of the exam, and how alert you are. Every point that they're giving, you should cautiously and carefully read it, otherwise you will miss it. If you just read monoarthritis is added in the major criteria, agreed, it has been added in India now, it's a high risk population, it is added as major criteria now, but they are specifically telling it is low risk. In low risk, we need to follow what was there earlier, and that is only polyarthritis. So minor criteria, 3 minor criteria can be used for recurrent rheumatic heart disease. Yes, that is correct. That's a true statement. So, and then fever is not 37.5, it is 38 degrees centigrade now. So you see, even minor things like it's 37.5 or 38 degrees centigrade counts. So this is also a false statement. So to summarize then this true and false sample question itself that I given, I think many of the choices here are a little tricky. If you're not careful about reading the choices, then you're going to miss some of these points. And even in PGI is the same problem, that some of the choices in PGI will be quite tricky, and to carefully read the choice by choice, and even a small word that is changed will change the response over here. So you can see this is the criteria, and I'm sure you might already be aware of the major and minor criteria for rheumatic heart disease. This 2015 Jones modified criteria. The low risk criteria is what was being followed everywhere. I mean that was the traditional criteria that was there in India also, but in most of the countries where rheumatic heart is very rare, like the Americas, this is the criteria that they follow in the US. Whereas if you look at high risk populations like in India, this is the criteria that we follow. So even minor things like earlier we used to say 38.5 degrees centigrade was a fever, and in India now we follow 38 degrees because that's a high risk population. In earlier we used to have only polyarthritis in the criteria. Now in the criteria for high risk, they're saying monoarthritis, polyarthralgia, everything is included in the major criteria. So to come back on true and false questions, then every choice that you read, you have to make a decision whether it's true or false. Remember, the positive markings are equal to negative marking. So if you're sure, then answer. If you get the question wrong, then you get minus 1/5. You get the choice one. Every statement here counts as marks. So if you get one statement correct, you mark the right thing, whether it's true or false. Whatever you mark it correctly, you get plus 1/5, and if you mark it wrong, you get minus 1/5. So those of you who have been doing PGI questions should not have any problem in answering the true and false questions at all. You should be able to manage it without any issue. Now, if you look at the reason assertion type of questions, generally these kind of questions are on the easier side. That's why the overall marking scheme also they have kept is it's not very high marks. The reason assertion questions we were expecting in NEET 2015, they came up with a booklet suggesting that even NEET should follow the reason assertion questions, and was recommended in the booklet at that time. They did not follow it in NEET, but AIIMS has come up with it, and chances are pretty high that the other exams might follow in the future. So if you look at the assertion reason questions, then they're giving you two statements, and you need to carefully read both the statements, and first make a decision whether each of those true statements independently is true or false. And once you make a decision whether the independent statement that you're looking at, two statements, are true or false, then you have to make a decision whether the assertion the assertion and the reason, look at whether the reason is the correct explanation of the assertion or not. We'll do many examples and you can understand how to do these kind of questions. You can see, for example, this question: assertion, in malignancy, the hypercalcemia is associated with increase in serum parathormone. Okay, that's the first statement they've given. And look at the reason: parathyroid hyperplasia is associated with increase in parathormone. There's no doubt over here. You can understand that the reason is perfectly, as an independent statement, it is true. In parathyroid hyperplasia, no doubt parathormone levels will increase. So there's no doubt that's a true statement. But look at this point here: in malignancy, hypercalcemia is associated with increase in serum parathormone. That is wrong, as you might already be aware that in malignancy, one of the main reasons for hypercalcemia is a peptide that is released from the tumor. This is known as parathormone related peptide. So parathormone related peptide acts like parathormone. It is responsible for creating hypercalcemia, and whenever calcium goes up, because parathyroid glands are normal, they are under feedback and they actually get suppressed. So this is the reason why serum parathormone levels are decreased. So that means the assertion is false. So you don't have to write it as true and false. I'm just telling you how your approach first should be in answering these questions. First decide whether two statements are true or they are false. We understood now assertion is false and the reason is true. Whenever you find assertion is false, it saves the headache of deciding for you to tell whether the reason is a correct explanation for assertion or not. So this is the kind of question that you should feel happy about, because anytime assertion is true, then you have to carefully look at the reason, and if reason is true, then you have to tell whether the reason is correct explanation for assertion or not. All this headache is gone. If the assertion is false, there's no issue at all. You're automatically ruled out many options. Like you can see, once you have decided assertion is false, the choice A says assertion is true, that is out. Choice B says assertion is true, that is out. Choice C says assertion is true, that is out. So basically you can see the moment assertion is false, three options are out. They are only left two options now. A is false and R is true, and both are false. Now obviously we saw that the reason is a correct statement, so the option here is going to be choice D. They also realized that assertion reason questions will give a natural advantage to students, because if one statement is false, you can eliminate multiple options in the list. So because you can eliminate multiple options, like if you say, for example, reason is false, then what all choices are saying reason is true can be eliminated first of all, and that will reduce the probability. And once you have, reduce the number of options and increase your probability of getting the question correct. That's the reason why I think AIIMS decided not to give +1 for this, but to give +1/4. So, but then these are the scoring questions. These are much more easier than the normal questions that you get, because you can easily eliminate multiple options. The more options you can eliminate and narrow down, the more easier it's going to be when you are answering the question. So let's try one more and see where we're putting assertion as a true statement. Now you see assertion here: Riddle's thyroiditis does not present with thyrotoxic manifestation. Now definitely that's a true statement, because many conditions, when you say thyroiditis, itis is inflammation of thyroid. When you get inflammation of thyroid, there will be leakage of thyroxine and transient toxic symptoms can occur. But Riddle's is an exception, that Riddle's will always have hypothyroid, will never have toxic manifestation. This is because Riddle's pathophysio is fibrosis. The entire gland gets fibrosed, and because of the progressive fibrosis that is happening, there's no leakage of thyroxine, and that's why it will never have toxic symptoms. So the reason assertion is absolutely a true statement. And look at the reason. Don't bother about the assertion. Consider independently, is the reason a true statement now. The pathology of Riddle's thyroiditis, progressive fibrosis of thyroid gland, definitely that's a true statement. So where the problem will come, I'll tell you. First of all, when you see a assertion is true, your headaches are going to be more now. You're going to be careful. Don't start looking at the reason already. Don't bother about whether reason is explaining assertion or not when you're reading reason. For the reason, just independently see whether that statement is true or false. Because if it's false, as you can see, you can eliminate multiple options. So first make a decision, is the reason on its own a true statement or not? We'll see whether it explains assertion or not later. But first see the reason. Now, there are some people who recommend that when you see the assertion, start looking at thinking in your mind about the explanation and then see whether the reason is there. That will not work out because the kind of reasons they give, they can be highly varied and there are multiple reasons for one assertion many times. So you can't think of many things. So I would suggest that will be a wastage of time. Correct technique, let me tell you once again. When you see a question on assertion, reason, first you see the assertion, make out whether it's a true statement or false statement. If it's a false, you're lucky. You don't even have to explain whether the reason is the explanation for assertion. You're saved from. If the assertion is a true statement, then when you're reading the reason, don't bother whether reason is explaining assertion or not. Just see whether it's a true statement by itself or not, first of all. If it happens to be a false statement, again, it's good for you in the sense you can eliminate multiple options. Wherever you see reason is true, that choices can be eliminated. But in this case, reason happens to be, the statement happens to be a true statement. Once you say that this is a true statement, then you can say now, yes, now A and R both are true. There are two choices in which A and R are true. All other choices you can eliminate because one of them is false. The only decision now is to make, is the reason a correct explanation for assertion or is not a correct explanation. Now yes, this is a correct explanation because it is fibrosis. Because of the fibrosis, there is no leakage of thyroxine, and that's why you don't see toxic manifestations in patients with riddles. So yes, assertion, reason are true, and reason is correct explanation for assertion. So most of my experience in reason assertion questions, we started preparing for reason assertion questions in 2015 extensively because NEET booklet at that time had pointed out Vision 2015. That is a booklet. Maybe you can still download it on the internet. It was called Vision 2015, and in that Vision 2015 they had mentioned key reason assertion questions should be included in the PG entrance exam. Now, at that time, we had done a lot of research on it, a lot of working on it, and all that. We had started, put a lot of effort on assertion reason questions. Ultimately, it didn't come in the exam, but then we were quite prepared for it. So, what I have noticed in most of my thing is key. If one of the statements is false, whether assertion is false is the easiest question actually. If reason is false, that also is fairly okay. When it gets tough is when both are true, because when both are true, you should be very clear whether that reason is a correct explanation for assertion or not. Sometimes that becomes a little tricky because there may be multiple mechanisms why that assertion might be occurring, and for you to explain that reason is a correct explanation for assertion sometimes can be a little tricky. So you should be a little cautious in these questions, especially when both are true. Look at this question. Assertion, the most common cause of unilateral bilateral proptosis is Graves' disease. I'm sure you're all aware the most common cause of proptosis in an adult, whether unilateral or bilateral, definitely is Graves, and that is because of glycosaminoglycan deposition. This is an easy one. So the first statement is no doubt true. Look at the reason. Now be careful here. I was telling you, when you start reading reason, don't start looking at it as an explanation for assertion. First read the reason and see whether it's an independently true statement or false statement. There is a retraction of eyelids, which is known as Dalrymple sign. Now, no doubt, Dalrymple sign is nothing but retraction of eyelids. So that's a true statement. So both are true statements now. Now it's easy. We know Dalrymple sign or retraction of eyelid is got nothing to do with proptosis. Proptosis is glycosaminoglycan deposition. That is the reason why the proptosis occurs. So assertion, reason are true, but as reason is, the R is not the correct explanation for A. Reason is not the correct explanation for assertion. So these examples that I'm showing you are, in medicine, but I'm sure the other subjects that you're going to get, they're going to be equally easy. And overall, the probability of getting these kind of questions correct is much better. That's, I think, one of the reasons why they're giving for this entire question 1/4 as positive. But then if you get it wrong, you get 1/4 negative. One more question before we move on. The investigation of choice in acromegaly is oral glucose tolerance test. No doubt that's a true statement. acromegaly is commonly associated with diabetes mellitus. That is also a true statement. But obviously, we don't do OGTT because diabetes is there in acromegaly. The reason why we do the oral glucose is going to suppress growth hormone because it is under feedback, which means then assertion, reason are true, but reason is not correct explanation for assertion. So some of these choices, some of these questions that I've given you are pretty easy. Some of them are not that. But I think these are going to be the scoring questions for you in the exam, and you should not have much problem. As I told you, go step by step. First, decide in your mind whether assertion is a true statement or reason is a true statement. If you find either of them is false, then you can eliminate multiple options. If best is easiest question, I would say, is if you get assertion false, then you can you don't even have to explain whether the reason is the explanation for assertion. That means multiple choices can be eliminated. You'll just be left with two choices, and that you can easily narrow down and answer. Any randomly, probability wise also, you're getting 50% chance of getting the question correct if you can narrow down to two choices, which means that is a good thing. Finally, try this question. Klinefelter syndrome is associated with hypogonadism. Definitely that's a true statement. You all know Klinefelter comes with hypogonadism. But the reason they're giving is serum FSH and LH are low in Klinefelters. That's a false statement. And this is because it's primary hypogonadism. The disease is in the gonads, and the gonads are shrunken and small. So because of this, pituitary not at fault, hypothalamus not at fault, LH FSH levels will be high. The disease not in pituitary or hypothalamus. This is in the testes, so you'll find that this patient is going to have higher LH and higher FSH. So obviously, once you say that reason is false, you can say that in choice A, reason is coming true, so that is out. Choice B, reason is true, that is out. And choice D, reason is true, those are out. So that means you're talking about A and these two choices left. So obviously here the correct answer is choice C. So this is how you can answer questions on assertion and reason. Then they're giving match the following type questions. Now, match the following questions, first impression you might have is they might be easy questions. But then the problem is that the column B has got multiple options. Although they might give you some of the options which might be, you can just look and say, okay, this is not something that will ever be possible. Like giving some cackling goose and all that's never going to be, a vector anywhere in any of the transmissions. So some maybe one or two choices if you can eliminate of the column B and say that we've never heard of, that is out. But the rest of it you should be able to answer. And remember, every correct option that you're going to get here, you're going to get 1/4 correct. And every wrong match that you're giving, you're going to get negative 1/4. So as I was telling you, in all the new pattern questions, they have kept negative marking equal to positive, raising up the stakes. That's one of the problems. So this question, I'm sure you are all aware, ki Nipah virus, and many of them you might be just be aware because they are, they've been coming in the thing a lot. So I mean, of recent they have been in the media also, and a lot of people have been talking about. So Nipah virus became very popular, and then fruit bats as what you need to consider. I'm sure you are aware ki KFD is Culex. Japanese encephalitis is Culex. Casanova forest disease, heart ticks actually, and Japanese encephalitis is Culex. Lassa is actually the multi-mammate rat. So overall, every correct thing that you're going to put, you're going to get plus 1/4, and any of the things that you're making a mistake, you're going to get minus 1/4. Then they have sequential arrangement type. Sequential arrangement type questions, they're giving +1 and -1. In this sequential arrangement, they can give you about a sample question here I've just given you. Arrange the sequence of cardiac markers that come out in acute myocardial infarction. Now you know that in the first 2 hours, the first marker that will come out is going to be, first few hours actually, is myoglobin. Okay, that's the first marker to come out, and that is myoglobin. And then the next marker that comes out around 2 to 4 hours is going to be creatinine. And then around 4 to 8 hours, the markers that coming out is troponin. And then around 6 to 12 hours, the marker that comes out is CKMB. So if you are aware of the way how the cardiac markers come out, then you can easily arrange it and say, okay, now this is basically myoglobin first. And actually, even if you know one that comes out first, and I think that also might help you pick out the choice, because see, once you know 4 is the first option And unless they're giving multiple choices where 4 is starting with, this is also going to be easy for you. So see how they are giving the sequence. And I think even if you know the first one that is supposed to come out, or the first tumor that occurs at in a pediatric age group, so they might give you a list of tumors and ask at what age groups they occur, or they might give you in the formation of say RBCs, what is the sequence of it is forms. So you got a hemopoietic stem cell, then a myeloid stem cell, and then you have the various normoblastic phases, the reticulocyte, and then mature RBC. So the sequences of how some of these are generated, they might be asking. And even if you know the first one, I think somehow you can eliminate some of the options. So I would say don't be worried about these kind of questions unless they are giving multiple choices where they are starting with say 4 over here. You all know myoglobin is the first marker. So unless multiple options are there, they were starting with 4, you should not have much problem in eliminating the options. Any question in which your elimination power is better is actually an advantage, and on the day of the exam you will find it much comfortable and much more better to answer those kind of questions. But here you should know, as you can see here, that this is going to be +1 and -1 if you get it wrong. Then you have the multiple completion type, and I think this is one of the easiest actually, and that's the reason why they've kept less marking for it. It's 1/4 if you get the question correct and 1/4 negative if you get it wrong. Now, why this is so easy is even if one statement you know, like for example, you can see this. These are 4 statements that are there. Most common type of stroke is ischemic stroke. So even if you know one statement is true, then you can utilize that and eliminate options. Like once you know A is true, let the other choice you may not be aware. But once you know one statement is true, then you know the choices where A is true. Is there in A, is there in B, and is there in D. Then see if you can eliminate even one option. So thrombolytics have to be given up to 4.5 hours. It's not 12 hours. In myocardial infarction, we can give up to 12 hours. In a stroke patient, the upper limit when you give thrombolytic is 4.5 hours. So many of these things, I'm sure most of the entrance going students will be aware. So once you are able to eliminate and say, okay, this is not a correct statement, this is a false statement, then you can say now B is false. That means you can eliminate A, you can eliminate D, you can eliminate C. All these are out. That means the answer is going to be A and C. So B is a false statement. Now in hemorrhagic stroke, systolic BP is to be reduced below 140. Whether you are aware of that or not doesn't matter, because you have eliminated most of the options and you are narrowing it down into B. So other two choices, whether you know it or not, now as you can see, I was able to eliminate an answer. Let me repeat it once again. Look at the first statement. You all know most common type is ischemic stroke. Hemorrhagic stroke is not frequent. One statement also, if you know, then you are already starting your approach in eliminating options. Once you say that A is true, then A is coming in the first statement, A is coming in the second statement, A is not there in the third one, and A can be there in the fourth. So basically now you're saying that A, B and D, any of them can be answered. Let's look at the next one. Thrombolytics to be given within 4.5 hours. As I'm telling you here, most of you when you're going for the exam like an AIIMS exam, you will be aware that stroke now acute management up to 4.5 hours thrombolytics have to be given, not up to 12 hours. So once you are aware of that and you say B is false, the moment B is false, you're going to eliminate choice A. You're going to eliminate choice D. All choices are correct, not possible. Now, if you say B is false, that means even choice C is out, because choice B is saying B and D are correct. Now, notice here, I've not even looked at choice C and not even looked at choice D. So even if you don't know all the 4 statements, even if you know 1 or 2 statements in the entire question, you can eliminate this option. So overall, these are high scoring questions, and you will find that these questions are much better to answer in the exam. But the sad thing is they have not given +1 for this question. They've just kept +1/4 if you got it correct, and negative marking is 1/4. So there was somebody, some students who are feeling a little worried about the pattern. I would say, see, most of these patterns, whether it's assertion region, whether it is multiple choice, I think it gives you a better elimination power. If you are able to eliminate options more, and without even knowing the entire question, if you can eliminate options, I think that it gives you an advantage rather than a disadvantage. So take it in a positive way rather than in a negative way. And don't forget also that more of these kind of questions that AIIMS will ask, less of image-based questions will come, and some of the image-based questions that we have seen in AIIMS were a little tricky, and you need to be careful. You had to be careful in those kind of questions, and I think once they start including including those kind of hi-fi images and all that they used to ask are going to come down. So if you look at the extended matching, they're going to give a theme and going to give you clinical vignettes, and using those vignettes you're supposed to tell what the diagnosis is. So I think these are going to be a very easy. See, the thing that you need to understand is key. Once you have a sentence, the factual kind of question, they are very difficult to answer. Once they give you an entire big question, then the more data they give you, the more sure you are in what direction it's going. So I would say you never need to worry about these kind of questions. The bigger the question, the better it is, because they're giving you more data, and something or the other in the question will help you eliminate some of the options and narrow down in what the answer is. You're seeing a description here that this is a sample question that AIIMS is given. So basically you can see there's a 30-year-old male coming with fatigue. The theme they're given in this question is fatigue. They're giving you this vignette, and very fast you can just read through. This patient has got anemia, he's got cervical lymphadenopathy, he's got a hepatomegaly, he's got a massive splenomegaly, a 10 centimeter spleen going below coastal margin, means it's a massive splenomegaly. And then you are seeing the hemoglobin is 7, anemia is there, total count, this is an anchor point for you, is very, very high. So if you're getting an 85,000 count, then definitely that is quite high. Platelet count also is high. So smear is showing anastocytosis, normoblasts are seen, neutrophils, precursors are seen, basophils are increased, occasional blasts are seen. And what is important is you can make out that they're giving a lot of precursors, telling you there's a left shift that is happening in the WBCs, telling you this might be a chronic leukemia. So look at the choices. And I would say in these kind of clinical vignettes, first read the list of choices and you'll have an idea what you're supposed to search in the question. So all questions, generally what we recommend is key, first read the stem of the question and then read the choices. There are certain questions where it's better to look at the choices first before looking at a question. One is when you see very large questions which are clinical vignettes, always look at the choices first and then see if you can pick up something that is there in the question, number one. Number two, all image based questions, read the stem of the question, read the choices before you look at the image. Search the choices in the image. That's a correct technique. Now, I have seen some students, they see an image, and once they see an image, you know that once you see an image, there's no limit to what all you can think of. The probabilities are huge. So you see an image, sometimes I've seen students think of some very difficult or very rare, some kind of, peculiar diagnosis. And then they see the choices, then whatever they have thought, it's not even there in the choice. The first thing is it'll break the heart. Okay, what we've decided is not there in the choices. This image-based question I'm talking about. So what happens, and I've seen this, what actually pulls them down is they saw an image, they made some diagnosis, and that diagnosis keeps them bound. Now, when they see the choices, they don't freely give a chance to every choice. Had they done that, they would have got the correct answer actually. But they have bound themselves up with some diagnosis and they're trying to choose a choice closest to what they had already thought. So that is going to be the reason why they get that question wrong. So all image-based questions, please follow correct. See, proper techniques are very, very important in our exams because the competition level is so high now. If you're not following proper approach and proper techniques, then it is something that is going to pull your marks down. So for all image-based questions, read the stem of the question first, read the choices and search the choices in image. That's always better. That will not allow you to freely start thinking about multiple things and then getting confused. So you'll be able to easily pick out, like say there's a ECG and one of the choice you saw WPW. Now you know what you need to search for in WPW syndrome in the ECG. So it's very easy. You just see whether the PR interval is short or not. If you can make out a delta wave, your job is done. That is WPW syndrome. So anyway, you can see they have given you some thalassemias, acute leukemia, hereditary spherocytosis, and there's even a chronic myeloid leukemia. So mentioning of precursor cells, left shift, metamyelocytes, myelocytes, 1% blast also there. So all these are highly suggestive that is going towards a CML. Typical presentation of chronic myeloid leukemia, most of the time they are asymptomatic at the time of diagnosis, or they might have some bone pains and they might have splenomegaly. So a spleen is sometimes an early presentation of chronic myeloid leukemia. So that's how the question that they are describing. So all these questions, again, it might look difficult for you because the question looking so big. But then once you look at the choices and you're searching, it will not take much time, because once you're familiar with what kind of choices they're asking, then it's very easy to search what is it fitting in. Take a look at this question and you'll yourself understand. They're talking about a patient coming with pallor and icterus. So basically anemia is there, jaundice is there. There's a patient who's got fatigue. He's already got gallstone. So jaundice, gallstone and anemia. What does that tell you? Anemia is there, jaundice and gallstone. Means what? It's a peripheral destruction. This is hemolytic anemia. So once you've decided it's a hemolytic anemia, they're also telling you family history is positive. So which of these conditions would you say is a hemolytic anemia with family history? Okay, family history is there. Father has got the disease. Grandfather has got the disease. Family history is there. Anemia is there. And patient has got jaundice and gallstone. So it's a hemolytic anemia coming with family history. So what do you think? Already I'm sure you made up your decisions. This is going towards hereditary spherocytosis. Read further and you can confirm more. They don't need transfusions. So obviously we don't give transfusions. This is not a thalassemia case. This is hereditary spherocytosis. Spleen is palpable, and you can see they have given anemia is mentioned, RBC count is mentioned, red cell distribution is high, retic count is high. Retic count is high, telling you marrow is not at fault. Marrow actually producing more cells. Serum iron studies did not show any abnormality, and you can make out that this is basically unconjugated bilirubin. Conjugated fragment of bilirubin is normal. Conjugated fragment is normal. Unconjugated bilirubin is increased. So this question is there in the booklet, and you can definitely read at your leisure and go through. My point is that most of the question patterns that are giving now are not going to make it more difficult for you, or rather they are going to make it more easier for you. Except a few kind of questions I would say is little worrisome, and those are the questions that when I am doing, I would have kept them in the last. One is the clinical vignettes, because sometimes vignettes might burn up patients. It might take up a lot of time, and that might be very crucial for you. So maybe vignettes you can keep it in the later. Match the following is another thing that I would be a little worried about. But the rest of the thing, I think they are actually an advantage, because once you start getting elimination power, every choice you eliminate, every statement that you say, then based on that you can eliminate multiple options, then that actually is a positive thing, it's not a negative. It is going to give you a better advantage than what you've been getting in the routine AIIMS pattern. So even the vignettes, I think they're going to give you easy ones. They're not going to give you something very difficult. Basic patterns, if you know of certain diseases, you should be able to eliminate and easily answer. So to summarize then, there are 7 patterns that they are talking about. One is the traditional pattern, the single best response. They have added now multiple true false, match the following, sequential arrangement, multiple completion, reason assertion and extended matching. Now we've discussed all these sample questions. At this point, let me remind you once again, whenever you are answering in the exam, please be careful about keeping for review. Anything you kept for review will be considered as unanswered. So last 15-20 minutes, make sure you're not keeping anything for review. Whenever you kept anything for review, better not to keep a factual question for review in the first place. If you are, then when you come back to the question and look at it, then changing that choice may actually, the first impression that you get in a factual question actually is the best impression. So better not to go ahead and change it. In a conceptual question, yes, you can modify it and you can change it. And if you logically find a better answer, you can modify your answer. Now let me tell you the good things about all this pattern is going to do for you. Number one, the image-based questions, which I think used to be a little tricky in the AIIMS exam, are going to come down. That's a positive thing. Secondly, the many questions like say reason assertion questions or the match the following. The multiple completion or sequential arrangement. Sequential arrangement I think a little tricky. Match the following a little tricky. Barring those, I would say all the others are pretty easy. The vignettes you will find in the exam going to be much more easier because once the theme is there and you understand what the basic disease they are going towards, it will not take much time for you to read it and answer. So reason assertion you will find extremely easy because I told you any one statement is false, you can eliminate multiple options. So that's going to be easy for you. If you are seeing multiple completion, that means they're giving you A, B, C is correct, A and B is correct, B and C is correct. Those even one choice, one statement also is true or false. You can without even reading the remaining question, you can decide what the answer is. So I would say in this the tricky parts are the sequential arrangement because sometimes you have to be very careful about at what age certain things present or what is the way how it progresses. Like for example, you should know exactly say the RBC's formation It is the myeloid stem cell. Then what's the next step? What's the next stage? So they can ask you to arrange the stages. They can ask you about the age at which various diseases occurs. So those things might be a little tricky. So I think sequential is a little problem. Match the following, I would say, a little problem. It would not have been problem had they kept the options equal on both sides. But since they're increasing the options on one side, I think that's going to be a little tricky. I think true and false is just going to be like PGI. And if you're careful about the choice and they're not putting any trick in any choice, then I don't think you should be able to have a problem in true and false. So these are some of the tips and tricks that I thought I could share with you at this point. I really think you should take it as a very positive way, the change in pattern. All those people who have built good concepts and who have read well, these things are going to actually be helping you rather than pulling you down. The gap between those who are going to use some shortcut method and doing some memorizing and something getting through becomes more difficult with these kind of things. People who really understand the subject, people who have core knowledge of the thing are definitely going to have an advantage. And don't forget also that this thing is change is not just for you, it is for everybody. So if you have a disadvantage, everybody else has, and if you have an advantage, the others also might. And then eventually, I think most of the patterns that they're trying to do should give an advantage those who have read and compared to those who have not read, those who understood a subject compared to those who have not understood the subject. So all people with conceptual approach who have understanding the subject definitely will have an advantage in this kind of system. So my best wishes to you. I hope to make some more videos discussing about more tips and tricks that I can think of in answering these questions. So as and when we will keep you updated. And I don't think that the July session you need to worry much, because they're going to, as they have put it below the thing table, that the July session is going to be a majorly a single best response that we've been used to. So they're not going to change much in the July. But I think for the November exams, you can start preparing with these kind of patterns. So my best wishes and good luck to all of you.